TrollByte Kimera presents a very convenient dental radiography sensor holder system. We had a very satisfying experience during several years. The main features of this system are the simplicity and the ergonomy. The system has different holders: blue for vertical periapicals and bite wings, yellow for horizontal posterior periapicals, red for posterior bite wings, an endo block, a circular aiming ring, a bite block. The aiming ring is color-coded, and each color corresponds to a specific holder. For posterior bite wings, we use the red holders with the specific position on the aiming ring. It is very simple. When the sensor is in place, we introduce the holder slightly inclined in the mouth, then straighten up for not hurting the oral soft tissues and the tongue. Once the patient bites on the holder, the X-ray cone is placed perpendicular to the aiming ring and parallel to the holder. The same mount is used for the opposite side without modification. A well-positioned cone and holder result in a successful bite wing with open spaces between crowns of teeth. For anterior bite wings, we use the blue holder but in a bite wing position of the sensor. The yellow holder is perfect for posterior periapicals. It is positioned on the aiming ring according to the yellow dot. You can see the sensor centered through it. Once inserted in mouth, it gives a very quick, stable position. The X-ray cone is placed perpendicular to the aiming ring and parallel to the holder. The same mount can be used for the other side, but opposite arch, by flipping and placing in the mouth. Always introduce the holder slightly inclined in the mouth to not disturb the tongue and oral soft tissues. The blue holder is for vertical periapicals and anterior bite wings. For anterior periapicals, the bite block is essential for having a steady position and successful radiographic technique. The sensor is centered and you can see it through the aiming ring. With the Kimera blue holder and bite block, anterior periapical radiographs are easy to realize. Upper and lower periapicals can be taken just by flipping the holder. For posterior teeth with long roots, it is very helpful to use the blue holder for posterior vertical periapicals, especially during diagnostic or endodontic procedures for teeth with long roots or in presence of rubber dam or clamps. This technique is also useful during implant surgeries, when we need to visualize the implant and the surrounding anatomical elements, for example the sinus. For endodontic procedures, the Kimera endo or endo block is indicated. We fix it on the holder like the bite block. With the help of the endo block or Kimera endo, the holder will be stabilized between teeth without disturbing the clamp or the endodontic files.